Dr. Lim Wee Kiat, my parliamentary colleague and Member of Parliament for Sembawang JRC. Dr. Lim Chok Peng, Chairman of Kidney Dialysis Foundation. And Mr. Lee Im Peng, Chairman of the Sangwang Wuti Religious Society. Ladies and gentlemen, good afternoon. It's my pleasure, very much my pleasure, to be here to grace the opening of the new Kidney Dialysis Foundation's 4th dialysis center, and supported by the Sangwang Wuti Religious Society here at Admiralty Link. The Kidney Dialysis Foundation, KDF, was founded more than 25 years ago with a mission to look after the underprivileged patients with end-stage kidney disease, look after them, and also provide them with the financial assistance for their dialysis treatment. The majority of KDF's patients live on less than $1,200 monthly. And the monthly cost of dialysis, medication, treatment for those patients is more than $2,000. Closing that gap is a challenge for all of us, for the patients, for the public sector, for the community volunteers, and for the societies such as Sangwang Wuti raising money to close the gap. So to hear that 80% of Kidney Dialysis Foundation patients pay no out-of-pocket payments because of a combination of all the subsidies is really very heartening, and it tells us that we can look after the most vulnerable low-income patients in our society in their time of need. And I thank you all for your support to be able to bring us to this point. And so with the opening of this Sangwang Wuti KDF Dialysis Center here at Admiralty Link, more patients will stand to benefit. The new center will have 19 hemodialysis stations serving more needy patients. End-stage renal disease, the kidney disease that we are talking about supporting these patients with, is a growing nationwide concern. Today, every day in Singapore, we have 6 new patients diagnosed with kidney failure every day. And this is an increase from about 4 every day in 2011. This trend is set to increase as our population here in Singapore gets older, it ages, and together with an increasing prevalence of chronic disease such as diabetes. So we have to deal with this trend. We cannot wish it away. It is there. It is worrying, it is serious, but our approach to dealing with it has to be multi-pronged. It has to involve a wide variety of solutions, providers, treatments, from prevention, education, and the active management of the disease. For those with chronic kidney disease, those that are not so serious, not the ones that need dialysis yet, those with chronic kidney disease, it's very important that we take steps to prevent progression of the disease, avoid and delay and prevent kidney failure. And so to this end, since 2017, the Ministry of Health, MOH, we have progressively implemented what we call the holistic approach in lowering and tracking chronic kidney disease. It's a very long name, but the important thing about the way in which we have named it is the second part is chronic kidney disease, CKD. The first part, it spells halt, stop. So we want to halt chronic kidney disease. This program is across all public healthcare institutions. This HALT CKD program, it seeks to retard the progression of chronic kidney disease by optimizing the protective medication that we give to patients and ensuring that the patients with early disease are well monitored closely to better manage other risk factors such as diabetes, hypertension, and lifestyle factors. Importantly, things like smoking and managing their weight. Diabetes is a leading cause of chronic kidney disease. In 2021, we estimated that about 1 in 3 patients newly diagnosed with kidney failure also had diabetes. So it's important for us to prevent chronic kidney disease and kidney failure, and one of the ways we can do that is better managing diabetes through our upstream efforts. We have been working with partners such as the Health Promotion Board and community partners, and hoping to create an environment that supports Singaporeans in leading a healthier lifestyle long before they have diabetes or any chronic kidney disease. We can start to intervene. We have to encourage healthy eating, increased physical activity, and going for early, regular, recommended health screening and follow-up. So you will have heard that earlier this year we have unveiled a Healthier SG strategy. And one of its key focuses is on strengthening our primary care sector, our polyclinics, our GPs, our family physicians. And we have to mobilize the skill, the resources, the people in this sector to play a greater role in preventive care and the management of the chronic conditions, like all the ones I've talked about so far: kidney disease, diabetes, hypertension, and several others like heart disease. Our family physicians, the GPs, they have cultivated a very close relationship with the families in their area. So they know the patients well, and these patients and families know them well and trust them. And so when these GPs give advice, give encouragement, hopefully these families, these patients, these individuals are more likely to comply with these instructions and do the right thing. Doing the right thing sometimes is not always the easy thing. So when you receive the advice from someone who's trusted, hopefully it is more likely to be successful. And this will then help them to improve their health. But no matter how much we mobilize the GPs, it will not be enough. The people that we are trying to help haven't yet got serious disease. They're not going to go and see the doctor every day. They are in the community. They are your residents, your neighbors, your friends, your colleagues. And so that living active lifestyle is part of our community engagement. And so community healthcare providers like the Kidney Dialysis Foundation, as well as community partners like many that are represented here today, grassroots, voluntary welfare organizations, religious societies, will also play an important role. And over the years, you also have built up close relationships with your networks, with your participants, with your friends, in the same way that the GPs have. People trust you, and so we hope you can help us to give good advice on how people can lead an active and healthy lifestyle. I'm glad to know then, we heard earlier on about the efforts from the Kidney Dialysis Foundation about educating, about reaching out, and not just providing the service, providing the financial assistance, but also helping to actively manage the health of the patients that come to you. And please continue to partner with us in doing all this important work. We thank you very much for your efforts. I would also like to thank everyone for their efforts involved in setting up this new dialysis center. It's a significant milestone in KDF's journey to serving underprivileged patients requiring dialysis treatment here in Singapore. Thank you very much.